I'm Colin Morton, a consultant dermatologist in Stirling in Scotland. Actinic keratoses are growth that many of us develop on the skin classically as we get older and after years of exposure to the sun, and they typically present as crusted areas on sun-exposed sites, so on our scalps, on our face, back of hands, on our ears, and our lower legs. And although individually they're very low risk associated with an individual actinic keratosis, or sunshine keratosis as we call them, there is a recognised increased risk of the development of skin cancer, and that risk increases the more actinic keratosis that we have. The actinic keratoses, we view these as precursors or the very earliest stages of skin cancer, and we're increasingly of the view that actinic keratoses sit in part of a continuum, part of a line that heads towards skin cancer and squamous cell carcinoma. And in recent years we've developed an understanding of quite a lot of features that, however humble a small crusted patch in the skin looks like, that it actually shares quite a lot of the abnormalities that a true skin cancer has. So whilst the risk may be 1 in 1,000 to 1 in 100 of an individual actinic keratosis ever transforming into skin cancer, into a squamous cell cancer, we don't know which actinic keratoses might develop, and we know that there's this common shared abnormality, and we now take this increased view that of the need of addressing these actinic keratoses and considering them for treatment. Patients that become aware that they are developing crusted lesions on their skin and these sun-exposed sites are most likely to present to their primary care physician first of all, and particularly in the UK. The vast majority of patients with sunshine keratosis, actinic keratoses, are managed by their general practitioner. Where the general practitioner is unsure of the diagnosis or whether they have a concern as to the correct diagnosis, then they'll refer these patients to a skin cancer specialist for consideration of more specific treatment. In countries such as the UK, where a lot of the care is delivered by the primary care physician, the patient presenting with actinic keratosis will be viewed as being that it is appropriate for them to receive treatment by the primary care doctor, and the primary care doctor would not necessarily feel that a patient would benefit or be able to easily have access to a skin cancer specialist. It often is a surprise that we have the need of skin cancer specialists in Scotland, given our climate, but given that we have an undue proportion of patients with very fair skin, the freckling, fair skin, red hair, our types are overrepresented, we have this increased risk of skin cancer. And we also have the problem that occurs with poorer climate, that the minute that it comes to holiday time, there is a charge to our airports and to head out the country to get blitzes of intense sunshine elsewhere in the world, and we know that increases our risk of skin cancer, so that there's a considerable risk of sitting with in our population. And we know that for example, over the age of 60, even in the UK, that we will find that around a quarter of individuals will have at least one actinic keratosis, and that number increases as we get older. My experience in the UK is the seasonality of consideration of skin cancer, and that is understandable, that it is classically when we get a period of good weather in May or June, then one becomes aware of skin cancer becoming discussed in the media, but it is then often forgotten about for the rest of the year. And it is often the case that although very important that the media focuses on the type of skin cancer that is melanoma, because there is a risk of dying from melanoma, that actually represents only 10% of skin cancer, and that the 90% of skin cancers that we develop in the UK split between basal cell carcinomas and squamous cell carcinomas, the ones that are derived from actinic keratosis. They often don't get to the stage of being in the media spotlight, and I think for that reason many of our population really aren't aware of the existence of these and view skin cancer as only melanoma. One of my concerns is the lack of awareness of many of the patients that I see in my clinic, that many crusted areas have developed on their scalp, for example, over years, and they have simply not been aware that these are precancerous skin growths, and that there is a potential of a number of treatments available to treat these, not only to improve the appearance and make the skin more comfortable, but actually, our aim is to try to reduce the risk of these patients developing skin cancer.